everyone, welcome back to my channel. Dr. Dominique Smith here. I'm a hospitalist here in Dallas, Texas. I practice internal medicine. Today I'm going to be discussing how to reverse type 2 diabetes. This is going to be a continuation from last week's video where I simplified diabetes. I defined it, I explained exactly how it wreaks havoc on the body, and I listed some of the common warning signs that your body gives you, letting you know you're heading in that direction. So if you have not watched that video, you may want to check it out, okay? On this channel, I plan to discuss many medical problems, but I really want to hone in on diabetes because this disease is what was responsible for taking my grandmother's life, a woman that played an integral role in my upbringing. My family and I, we had to watch this disease ravish her body. She started to lose her vision. She became blind. She started to lose her memory, her cognition. She had so many strokes and TIAs and seizures, way too many to count. And she eventually developed dementia. She lost her ability to talk, her ability to walk, and became bedridden. About 2 years after I finished my training, she was so far along in the disease process that there was nothing that we knew to do to stop the process. And she was on hospice care and she passed away. It was the saddest, hardest thing my family and I had to go through, mostly because she was the strongest woman, most determined, fierce, and independent woman. And watching her lose her independence was devastating for her and for us. There was nothing we could do. We felt helpless. If I would have known then what I know now, I could have done something to save her. We could have come up with a plan. I could have educated her about what was causing it. But, I can't save her. I couldn't save her. But I'm going to do everything in my power to save you, to save your loved one, your grandmother, your mother, your child. Okay, because diabetes is reversible. And I'm going to tell you exactly how to start the process. Stay tuned. Let's hit it. So how do we start to reverse the process of type 2 diabetes? Let's recap. What is diabetes? Diabetes is basically a hormonal problem caused by the hormone insulin that's responsible for taking sugar out of the bloodstream and driving it into the cell to be used for energy. When someone is resistant to insulin, the blood sugar levels continue to rise. Insulin tries to hide the sugar in adipose cells, in the liver, in the muscles, trying to bring that level down. But we continue to eat high carb diet. Carbohydrates get broken down into sugar in the body, okay? Over time, the pancreas, which makes the insulin, starts to dish out more and more insulin, trying to bring down the levels to the normal range of 80 to 100. And it can keep up over time for several years, but eventually it burns out and stops making insulin. And so the blood sugar levels continue to rise until it comes to a toxic level where you start to get complications, symptoms, blurred vision, frequent urination, fatigue, obesity, erectile dysfunction, numbness and tingling in the fingers and toes, and many more. That's essentially diabetes. So the first step to reversing this process, stop listening to the guidelines. The American Diabetes Association recommends that 50% of our diet consist of carbohydrates. So let's think about that. On a 2,000 calorie diet, 1,000 calories should be coming from carbohydrates. That equals to about 250 to 300 grams of carbs a day, which get broken down into sugar. They go on to mention that carbohydrates is known to be the single biggest factor increasing your blood sugar. They go on to say that this is a progressive disease that will lead to you needing medications, and over time you will need more medications to control it. And then once you take the medications, in order to keep your blood sugar level from dropping, which is a side effect of taking the medication, you need to eat more carbs. Okay, so they're telling us to overdose on what's causing the disease and then take more of it to prevent the side effects from the medications that they push on us. And nowhere in the recommendations do they mention that this disease process is reversible. So why would they be telling us to eat exactly what's toxic to us? It always boils down to the bottom dollar. Chronic progressive medical conditions leads to chronic use of medications, which make a lot of money. Okay? I was looking at a report, the insulin industry market value report. In 2018, they grossed greater than $21 billion. And it's anticipated to go up to $60 billion by 2025. The global metformin industry market value report stated that in 2019, they grossed $248 million. And by 2027, it'll be up to $331 million because the increasing prevalence of diabetes. Okay. Now, 50% of adult Americans have been diagnosed with diabetes or prediabetes. And that comes out to be about 120 million people. And that's not taking in account those that are insulin resistant, that will eventually develop it. Studies have shown that 16 to 25% of normal weight adults are resistant to insulin, and they're heading in that direction. Okay, so when you think about why are they recommending that we eat what's toxic to us? Diabetes is basically carbohydrate overdose, and they're telling us to eat 50% of our calories daily. Always boils down to the bottom dollar. All right, guys. So we need to start doing what makes sense. Stop listening to the guidelines and those recommendations and do what makes sense and take care of ourselves, because they're not worried about taking care of us. They're worried about making money. Okay. All right. So how are we going to do this? There are 3 options that have been shown to be effective in reversing type 2 diabetes. They defined the reversal process of a hemoglobin less than 6.5 or being off of diabetic medications and maintaining a normal blood glucose level of 80 to 100. Out of these 3 options, there's one that I'm going to elaborate on more than the others because I feel like it's the best option. But as a physician, I understand out of 120 million people, you know, one treatment is not a one-size-fit-all type of thing. Okay, so I am going to go through the options that I found. First one, bariatric surgery. Anyone that has seen that show, My 600-Pound Life, Dr. Z, he performs these procedures. I love that show. I'm addicted to that show. Okay, and yes, it is very effective. Hemoglobin A1C and weight loss can occur quickly. Actually, hemoglobin A1C and reversal of type 2 diabetes can actually occur within the first few weeks. Okay. There's 2 types of bariatric surgery, the Roux-en-Y and the sleeve gastrectomy. Okay. The Roux-en-Y, it's more invasive, it's more effective, but it is reversible. It's reversible. Okay. The sleeve gastrectomy, it's less invasive. There's less complications. It's still effective, not as effective as the Roux-en-Y, but it's irreversible. Okay, they are effective, but when you think about it, you know, there are risks to surgeries. There's cost. I think it's about $18,000 for the procedure. And it's pretty drastic. It's drastic. It's a surgical solution to a dietary problem. Okay. The second option the very low calorie diet. I read studies where they ranged from 300 to 1,800 calories a day. 300 calories a day. Can you imagine that? You're essentially starving yourself. You're hungry all the time. Now, how long are you going to be able to sustain this diet? It's very effective. Again, hemoglobin A1C, less than 6.5. Patients are off their diabetic medications and quickly. But what happens when you start eating again? Hemoglobin A1C rebounds, so does weight rebound, probably higher than it was before you started. Why? Because you weren't eating as much as you needed to. Your basal metabolic rate decreased. Your metabolism decreased. So once you start eating again, you blow up. So does your hemoglobin A1C. Blows up. Okay? Not sustainable. So let's go on to the third option. This is what I feel is the best option, and that's the low carbohydrate diet. I'm going to focus on the ketogenic diet because I think it's the healthiest. It's been studied more than the others, but there are several diets out there that are low carb diets, such as the paleo diet, Mediterranean, South Beach, the Atkins diet, and there's more out there, okay? So what are the goals of the ketogenic diet? Okay, you want to keep your carb intake low, and you want to eat less times a day. Okay, because when you eat carbs, your insulin goes up. The goal is to keep the insulin down. When you eat, your insulin spikes. So you want to eat less times a day. We want to switch from using carbohydrates for fuel to using fats for fuel. So you're able to eat less carbs. Carbs actually spike your insulin, like I said, and it makes you hungry. So you eat more times a day. When you're burning fats for fuel, you're keeping your insulin levels low and you're more satisfied throughout the day, so you can go longer periods of time between meals. And when you combine a low carb diet with eating less times a day, which is intermittent fasting, that's when you get the optimal results. Okay? How many carbs can you have on a ketogenic diet? We want to stick to 20 grams to 50 grams of net carbs. That's the total amount of carbs that you see on the label minus the fiber. That'll give you the net carbs. 20 to 50 grams a day. Okay? So what do you want to stay away from? You want to stay away from sugars in any form. Refined sugar, honey, nectar, agave, cane sugar, date sugar, all sugars. You want to stay away from it. So what can you have? You can substitute those sugars with sugar alcohols, and there's many of them. I'll list them above. I enjoy monk fruit. I also enjoyed erythritol when I tried it. Okay? Another thing you want to stay away from are fruits. Okay? Now you can have berries, strawberries, blackberries, and raspberries. You want to keep it, in a small amount, but you can have those. But you want to stay away from apples and bananas, okay? Sweet fruits like that. They're high in carbs. Grains, wheat flour, anything made with flour, pastas, breads, donuts. You want to stay away from that stuff. High in carbs, okay? Substitution for that, you could use almond flour. What are you going to make your cookies out of and your breads? There's a lot of recipes out there on how to use alternative means for the flours. Almond flour is very good. Okay. Starches, potatoes, rice, quinoa, French fries, potatoes. I said that already. Stay away from it. Okay. You can replace it with cauliflower. You can actually make meals like cauliflower mashed potatoes that has similar consistency. There's a crust, cauliflower crust that you can make for pizza. You can buy it at Trader Joe's already made, actually. You can make it on your own. Recipes are out there. Whole Foods, it's pretty good. I've had it. I enjoyed it. Okay. So these are the things you want to stay away from. So what can you have? Veggies, and lots of them. They fill you up. They have vitamins and nutrients, okay? They do have carbs, but very low. And you need to be healthy, and they actually fill you up. There are some veggies that are lower in carbs, but when you're sticking to 20 to 50 grams a day, recommend eating about 7 cups of veggies, okay? Kale, broccoli, peppers, red, yellow, Brussels sprouts. Take your pick, okay? All right, another thing that you should have, protein in moderation, okay? About 4 to 8 ounces. Measure out your palm or your fist, okay? That's how much you want to take in per meal, all right? You actually want to take in protein that's higher in fats, poultry, seafood, cheese, nut butters, nuts, okay? Fish, if I didn't mention that. And finally, higher fats, like butters, avocados, olive oil, coconut oils. Put these on your vegetables, put it on your meats. Okay, these will allow you to be satisfied longer between meals. You do want to stay away from higher oils such as vegetable oils, canola oil, cottonweed oil, safflower oil, sunflower oil. These have been shown to cause inflammation in the body. And when you're eating a lot of them, that's actually causing more damage than good. So you want to stay clear of those. Now let's move on to when you should eat. Now we want to focus on eating less times a day, which is intermittent fasting. So typical day for most people is eating breakfast, lunch, and dinner. All right. We want to cut out breakfast. If you're a breakfast person, start to just wean yourself off of the breakfast. If you're used to eating breakfast at 8 o'clock, eat it at 10. Okay. We want to push it back because we want your first meal to be at lunch at noon. Okay. Now you can have coffee. You can actually have teas, and you can put butter, MCT, in your coffee, and that'll actually help fuel you throughout the day, and it'll curb your cravings throughout the morning. Okay. And you can have your herbal teas. Just make sure you don't put any sugar in it. Okay. So your first meal will be at lunch, and you can have as much as you want. We're not focusing on low calories. We want to just keep the carbs low. Okay. Eat as much as you want. And the second meal will be at 6 p.m., around 6 p.m. for dinner. And again, eat as much as you want. Fill yourself up on those higher fats, on the protein, vegetables. Okay. So your next meal won't be until the following day at noon. That'll give your body about 18 hours of fasting, resting your body, resting your pancreas, so that you can switch from burning carbs for fuel to burning fats for fuel. Okay. And when you combine eating low carb with this intermittent fasting, that's when you're going to really see results. Okay. All right, guys, that's all I have for you today. Now, if you have any questions about what I mentioned, leave a comment down below. And if you found anything helpful in this video, please like, comment, subscribe, share, okay? Get the word out there. It'll help my video reach the people that it needs to reach, okay? Now think about it, guys. You got one life to live. Let's do it right. We've found out what's causing this problem, okay? Now stop doing it. Let's reverse it. You don't have to do it alone. Let's do it together. Next week, I'm going to be demonstrating exercises, the exercise that's best for diabetics. And then I'm going to also go through a keto meal day. So if you're interested in seeing some delicious keto meals that I make, tune in. Okay, it's going to be fun. All right, you guys stay blessed. One life. Till next time.